very much, and thanks to our sign language interpreter, Ronda Estell, for being here today. It's really terrific to have you here. So first, we're going to do some introductions to our panelists today, and then I'll be asking questions, some for individuals and then some for all. 2 points during, Tyler will take questions from the chat. So please put your questions in the chat if you have anything you'd like to ask. It's going to go quick, so we're going to try to get to as many questions as possible. So why don't we, starting with LaSaia, why don't we give introductions about the work that you do, and then we'll go to Michael, Greg, and Lamont.
Hello, everyone. My name is LaSaia. I go by she and they pronouns, preferably she in these settings to lack of confusion. I am the founder and executive director of Brave Space Alliance, which is a Black-led, trans-led organization on the south side of Chicago in Hyde Park. We do multiple mutual aid groups, support groups, as well as the Food Crisis Pantry, which is the first LGBT crisis pantry here in Chicago. So yeah.
Excellent.
Hi, I'm Michael Herman, the CEO of Chicago House and Social Service Agency. We're entering our 35th year of providing services to the community. We started as the first housing provider for those impacted by HIV and AIDS in the Midwest. Have expanded those services to include employment services, linkage to care, prevention services, and our Trans Life Center. Continuing to kind of adapt to HIV as it evolves, and making sure we're always there to serve those most in need. So we continue that work as we enter our 6th year.
Greg?
I'm Greg Harris. I'm a state representative, and my district is Andersonville, Uptown, North Center, Bowmanville, West Ridge, and Ravenswood areas. I'm also majority leader of the House of Representatives. And I actually got involved in community organizing and politics when the AIDS epidemic first hit the city of Chicago back in the 80s, when I tested positive and later was diagnosed with AIDS, and was watching my friends being neglected and suffering and dying, losing their homes, losing jobs, and while the government sat by with a lot of indifference. So, sadly now, like all of us, reliving so many of the same horrible memories yet once again.
Thank you. And Lamont?
Good morning. Glad to be on this panel. My name is Lamont Robinson. I represent the 5th District in the Illinois General Assembly. The district starts on the south end of the district in South Shore, goes along the lakefront to Old Town. And again, happy to be here. I have to always thank Tracy when I'm in her presence for outing me as the first Black gay elected in the state of Illinois. So again, thank you and glad to be here.
Thanks. Greg, you touched on this a little bit about the 1980s, and a lot of people have said there are both similarities and total differences with the crisis at hand now. Take us back to 1984, 85, and what was happening in Chicago that you might see parallels or differences with today.
So, and here, I'm going to just push my window down so the fire engines are coming. I forgot to do that before I got on this call. I live across the street from a firehouse. I think some of the similarities we see are the first reaction of a lot of people is to stigmatize those who are sick or may think they're sick around COVID. There's stigmatization, there is scapegoating, pointing out certain populations and blaming them, or some characteristic about a community for how the disease is being spread. And there's really a sense, and being a statewide elected official and talking to people all around the state, both in like my little area of Chicago and but Central Illinois and downstate, there's this whole us versus them mentality too. And you're seeing this now in this idea of, well, why do we need these restrictions? Which sometimes I hear is, I don't think people like me, you know, I think people would say, they'd say, people like me are not going to get sick and die. It's going to be other people elsewhere. So why should I have my lifestyle inhibited right now and have to abide by restrictions when I don't think anyone I know or that's in my family will suffer? That will be someone else somewhere. And the fact that it was in the AIDS epidemic, people said too, it's those gays, you know, it's those gays. And then it became particularly those gay white men. They're the ones who are, you know, transmitting it with their unsafe practices. And there was then, you know, growing realization that HIV was hitting other communities, and people, there were disparities in the treatments that were available and the services that were available, just as we're seeing now, as people realized that, you know, this was not like a gay white men's disease. This was a disease of, you know, sexual transmission, and it was disproportionately affecting communities of color. But because there was not adequate access to healthcare and testing, those numbers were not coming to the fore as much as they are now. And the same with women, not making it part of their routine healthcare for women to do appropriate testing when indicated, allowed further transmission, because society just did not view the illness in a clinical way. It was more in a sort of self-righteous way in a lot of ways.
Yeah. Absolutely. You know, I started my work in 1984, and there were fewer than 100 cases of HIV diagnosed in Chicago, and watched as a city and a country and a world really ignored it for quite some time. Our community had to provide the meals, walk the dogs, visit folks in hospitals, take care of partners, surviving partners when families kick them out. There are the immense ignorance around that disease is what to me is the most comparable here. And like you said, the lack of a clinical approach to it, people being afraid to, you know, just hug and do things that were not going to transmit the disease. Michael, you also have an experience in the 80s. HIV really changed the whole trajectory of your career.
Yeah, definitely. I think early on, my background was with the Catholic Church. I was served as a priest for many years in communities of color, particularly Latinx communities in Chicago. And early on, it just became very apparent. It was impacting all places. So all my mentors, my early mentors and friends were impacted by HIV and AIDS. My early mentor was a friend of the family early on, mentored me as a young adult. He died of AIDS as a pastor of a Catholic parish in Chicago. And the stigmatization, obviously, being gay and Catholic was huge to begin with. And then you add that layer of HIV, how it was just an unspoken. And I think that occurred throughout families, that occurred throughout communities, where someone would actually die and no one would talk about it. There was no conversation about how, you know, people would kind of show up and everyone maybe suspected, so then they wouldn't even ask what happened. Was ridiculous. How are you going to ever help stop the spread of something when people won't even acknowledge that it existed? And there was all kinds of shaming that went with it. And I think that is a huge problem the minute shaming comes in, where either a community is shamed or an individual is shamed. There is no way to move forward from a health perspective. And I think that happened in the early stages of HIV. And I think we're seeing that clearly happening again, especially as people get antsy and it's starting to impact them from an economic perspective. It's like we want to push forward, and we can't lose sight of making sure we acknowledge who is impacted by this and making sure they have the services they need. That was a huge loss. We lost thousands of lives because there was an inability to do that early in the HIV epidemic.
Thank you. LaSaia, are there unique concerns for the trans and non-binary communities related to COVID-19? One of the questions we had gotten from the public the last forum we didn't get to, for example, was chest binding, or the delay in options on, optional medical surgeries and things like that. What would you say to folks about the additional concerns there?
So there's a lot of different types of concerns, right? Chest binding automatically affects the respiratory problems with trans-masculine folks or masculine-centered or just butch women anyways. And it's automatically a compression on the chest. So when you're dealing with COVID-19, it's an automatic, should I have to wear this binary to do my work or do whatever I have to do? And face the understanding that I might receive some type of violence because my chest is out. Also, what we've noticed now, as well as since for trans women taking estrogen, estrogen automatically causes blood clots. So when what we found out is COVID-19 causes blood clots as well, and with the combination of both can cause death within a trans woman or trans family person that's taking estrogen.
Yeah, so lots of additional burdens there, and certainly one of those, Lamont, is that so many health disparities add to the fact that is why people of color and marginalized people in general are impacted. I have some old Windy City Times here, and this story here is from September 11th, 1986, and it's the fact that 40% of AIDS cases in the Chicago community were among Black and Hispanic folks, mostly male. And today we find this with COVID, right? Because of there's so many reasons, right? And can you talk about how, especially as a policy leader, policy-wise, we can deal with this, and also just on a community level as a Black gay man, how this affected you? I don't know your age, but my assumption is you are much younger than three of us on this panel, that you didn't necessarily experience the 80s the way we did, but you certainly came up into a gay community that was impacted by HIV.
Thank you, Tracy. You know, I don't mind telling my age, even though it's, you know, I look at myself, and at some point I had beautiful hair, and that's gone. But at 38, I went to school in Atlanta, and I went to Clark Atlanta University, and I had friends that contracted HIV, and I remember you know, those conversations with some of my close friends. Some of my friends, unfortunately, are not with us today because of HIV. And so, with that said, now in 2020, you know, knowing from a policy standpoint that a lot of members in the African American Latino community don't know about PrEP, don't know about resources that are out in our community, are not getting tested, is a problem, because we can combat this epidemic with PrEP and or getting tested. And so, you know, it's important as a legislator that I move things forward, funding, particularly for the African American Response Act. I was working on adding more funding to the African American Response Act, and just recently found out that the fund did not have any money in the actual fund. And that's a travesty for our community, because it is a fund that we use to stop the spread of HIV, and to learn that I take responsibility as an elected official, that fund has no resources in it, is a travesty. And so I'm working with partners to make sure that not only do we fund the African American Response Act, but we increase funding to the African American Response Act. And so that is where I come in, Tracy. And then also securing funding for a LGBTQ center on the South Side, which is extremely important. If that center was in place today, that center would be testing in our community. One of the issues that we're finding with COVID is that we don't have enough tests. People don't know where to go and get testing. And so again, not only is it important to fund the African American Response Act, it's also important to make sure that we have our own center on the South Side that can be a resource for the African American community. We're not surprised that we see high numbers in the African American community, as well as the Latin community, which is another legislation piece for me, is the Intergenerational Poverty Act that I have a bill to study poverty. This is an issue around poverty. It's an issue around lack of health care. And so as a policy person, those are the key things, the three things that I just mentioned to you that are important. And I am excited to get back to Springfield to push these things forward.
Excellent. So first LaSaia, then Michael, can you talk about how organizationally your nonprofits are dealing with the issues of mental health? And the questioner said, especially as it relates to the issue of re-traumatizing things that many people are experiencing. Like this whole crisis is bringing up so many issues that might have been dormant for people. So first LaSaia and then Michael, if you can address how your groups are dealing with this.
I can only speak to my particular narrative, right? For me, I already dealt with anxiety due to the fact that I have to run an organization and I have to be in a lot of spaces as a Black trans woman, right? And most of the time I'm privy to these spaces where we are never being able to be sitting at the table, and also speaking around the narratives of Blackness and also transness and the intersections of them too. Now, once this COVID-19 hit, my anxiety skipped a whole new generation for me. So it's the understanding of having conversations and having support groups to be able to talk to other people like me, even if they're being them Black or be them trans, having that particular narrative of understanding the particular type of struggle that we already deal with when we step outside of the household. That if most of us aren't passable or most of us are passable, we receive a different type of violence that most people don't normally talk about, right? There's a type of violence that we receive when we're not passable and what society deems as passable. And then there's a violence where trans women receive the same violence as cis women that we don't normally talk about because they're not equal the same as society says there are. So in this particular climate, mostly I've dealt with trans people that are sex workers that are normally, these are the moments that they are able to work, but they're more afraid of working right now in this particular climate to either not only receive the COVID-19, but also there's a higher level of receiving STI or HIV in this climate, because people are, if you're trying to do sex work, people are automatically struggling with their own finances, and they're charging not only less, but also it receives a less safety precautions that we can actually do to protect them as well in this particular climate.
Thank you. Michael?
I think for us, Tracy, I think mental health issues are huge for a lot of the clients we serve. I find the ones that live in our residential programs, we have a lot closer contact with. We have clinical professionals who are able to do telecounseling, telehealth with those clients, and that has been fairly successful. Our big challenges remain in our other work, our scattered site work, also our linkage to care work, which depends so much on face-to-face contacts, our Trans Life Center. A lot of that is dependent on our caseworkers, our case managers being able to have face-to-face contact. And that is having great impact because those aren't people we can easily link to other teleservices. There's a lot more struggling going on, those who are dealing with homelessness. We find those who have been put in shelter over the last year. We've housed about 60 clients who have experienced chronic homelessness. We find the anxiety has led to all kinds of situations, kind of more acting out behaviors happening in the units, and we cannot send case managers out to engage those clients. So there is a huge challenge right now, and we're trying to figure that out. But if you're already struggling to communicate with the client, how do you then help them with the crisis when we can't even try to intercede in a face-to-face kind of encounter? So experience a lot of challenges around that. I can't say we figured it all out, but I know our teams are strategizing any way they can when we have clients that have fallen off of communication, because we know there are a lot of consequences that can happen because of some of the mental health issues and because of kind of the crisis situation they're in that has been exacerbated by the COVID-19.
Thank you. Greg and Lamont, can you talk on a policy level how the state can do better or what they're doing currently related to these issues of mental health? Are there things that the state can do? First Greg and then Lamont.
Remember to unmute myself. You know, there is certainly a lot more we should be doing. The other effect, though, and this is going to go cross purposes to doing everything we're going to be doing. You know, the other effect of the pandemic is, as you know, businesses have shut down, as you know, people have lost their jobs, as people stop buying things. You know, income taxes, sales taxes, you know, all the revenue that we count on as a state to pay for the services that we need, that's dropped by nearly $7 billion now. And so we'll be going back, Lamont and I, this coming Wednesday to deal with, you know, how we do it. What do we do to replace $7 billion in our state budget? There's some federal emergency assistance for COVID that has come along. It's really strictly limited in what it can do, but we're trying to stand up supports for crisis counseling for people suffering particularly from COVID. But more importantly, if you talk to the agencies, whether it's an FQHC or a mental health center or a substance abuse treatment center, their clients have also gone away during this. They're not coming in for, you know, routine care and doctor's visits and, you know, whatever else they would come to, counseling sessions, therapy sessions. So they're pleading with us to just give them enough cash to sustain them in the community through the time that their clientele can start coming back. So that's another thing we're working on, is just preserving the existence of childcare providers, DD providers, mental health, substance abuse, you know, HIV housing, that kind of thing, our FQHC system, so that they'll still be here even in a couple of months, if that's how long it takes to reopen.
Lamont?
Tracy, great question. And not to reiterate what Leader Harris is saying, he's 100% correct. But I want to put a note out to our viewers and to Chicago House is doing great work, and to Brave Space Alliance is doing great work, and our other partners, is that it is going to be a fight. Our funding has been extremely cut, and so we're going to have to fight for really what you're talking about mental health, about HIV funding, because there are going to be other folks that are going to be lined up for funding as well. And so we're really going to need the viewers on the line to reach out to your representatives, to reach out to your senators, and let them know what you think is important in this budget. And then also we're going to have to lean on our organizations to also support our efforts to make sure that in this budget that it is aligned for communities of color and communities that unfortunately have been affected by COVID. And so again, this is going to be an extremely, extremely tough time, but we need everyone to help us support these efforts.
Great. So for LaSaia and Michael, as organizational leaders, Pritzker has talked about his plan for reopening and Lightfoot as well. How are you thinking about this for both your staff and your clients? LaSaia, why don't you start off in terms of how you're going to, there's no, you know, the new normal, whatever that might be on a month-to-month basis. What's going on for Brave Space now?
So there isn't a new normal, right? We need to understand that we are not going back to the same world. We're going back to a world where people are going to have high anxiety. We're going to go back to a world where people have set in their depression. We're going to go back to a world where there's a really a high threat out there that we don't know who's going to have it and who's not going to have it. And we're going to lose people during this particular climate until there is a vaccine. So what we've talked about is, what does it look like for us coming into the space to have masks? And what does it look like for us to not only protect ourselves, but also the people that we support and call members of Brave Space, right? right? So it's still in the conversation piece of like, how can we and what can we actually really do with not only protecting ourselves. As a person that is expecting, I have to be very weary around who I come in contact with, and also ask, have you been in contact with COVID? How are you feeling? So for me, moving in this particular type of space, I have to be very important around how I move with my own staff, because a few of my staff are immune compromised. So we have to be very wary around how we continue to support, but also teach them how to support themselves as well. So yeah.
Ronda, can I ask, I'm not sure if you can hear it, but I'm not sure if it's on your side or not, but somebody's got some noise going on in the background that might be kind of distracting folks. And I can't tell whose it is.
I don't know, on mute.
Okay, so I'm not sure where that's coming from, but maybe it's some other caller in. So Michael, if you want to address that question.
Yeah, I think we're having a lot of conversations. We are in a position where our lease is expiring in our current office in August, and we are looking at what are the best options for us. And so we've been in this process, a lot of dialogue. Office space is going to look completely different. You know, our team of 90 so employees will never probably all be in the office again in any type of mass setting. So really looking at, first of all, what office space looks like and what office time looks like, and rotating that space to be safe. And then also it's the face-to-face. How are we able to reestablish some type of contact with clients in a way, making sure our support staff has access to remote working abilities, all of those things. A lot of that is very technical, trying to figure out those pieces. I am not an expert in technology, but yet our organizations are really required to do a lot of those things in order to be able to function. But I also think it's going to be important for us to find ways to be physically present in communities in safe ways. I think we've had to work remotely and we've had to cut down that contact, and we still need to continue to be safe. But I think the disconnection from some of the communities has not been helpful. I think we're going to have to find safe ways to be in communities so that people who don't have all the communication, can't go online, maybe don't even have a phone, how are they going to be able to get services and supports that they need? We're going to need to be more physically present in some way in those communities. And that's something Chicago House is looking very seriously at, especially in communities most impacted by HIV.
Thank you. Greg and Lamont, can you talk about how the state, which every state seems to be an island in this epidemic, since we don't have a country anymore, how the state is going to be dealing with increasing testing and then contact tracing, and what role policy is going to play in that? Greg and then Lamont. Unmute, please.
You know, after another month of this, I might learn the unmute, but like every other state, you know, we are still, and as Tracy just said, you know, we don't have a country, we don't have a functioning president or federal government. So, you know, every state is literally out there every day competing against each other and competing against cities for the testing swabs and the vials and what they call the medium, or, you know, something that is essential to viral tests, and getting that out there. So we continue to try to ramp up the tests. I think now Illinois is about like the second or third in the country in the number of tests per day that are being done, but it is very unequally distributed. We still need more quantities to get access to testing, you know, in all different communities, you know, across the state. And we also have to keep monitoring the science. I mean, if you remember when this thing started, you know, like 8 weeks ago or however very short period of time we're into this, the guidance was, if you're asymptomatic, you should be fine. And people went about their business and they went to work and they went places. And now we're finding out that potentially people who are not showing symptoms or asymptomatic may be spreading at a greater rate than those with symptoms. So, you know, we've had to change that guidance. So I think we're still struggling to figure out exactly how this disease works and how it impacts different folks. You've started to see reports now that children are developing a new syndrome called Kawasaki Syndrome that's related potentially to this disease. So I think there's a big period of discovery. Fortunately, we have a governor who actually believes scientists and doctors and listens to their advice. He's also been very honest with people. They may not like, you know, the fact that we have to stay in place, but to protect our families and our communities and our neighbors, you know, that's what we're going to have to do for a little while.
Okay, that's either a baby or a cat. I can't tell because
that would be the cat, which is why I stay on mute.
The cat has something to say.
Say hello to Mr. Whiskers.
Hey, Mr. Whiskers. Lamont?
Yeah, Mr. Whiskers is the person that really runs the state. So now everybody knows who runs the state of Illinois. You know, again, Greg is 100% correct. I just want to add that we have to make sure that our organizations, our community groups are prepared for this contract tracing money. And that is key. How we get through this is really utilizing our organizations that are already doing great work in Chicago, in the state. And so those organizations, Brothers Health Collective and Brave Space Alliance and Chicago House and Affinity, and the list goes on and on, we need to make sure that those organizations are prepared when the federal government finally gives us funds for contract tracing. We need to utilize those organizations that know our community, and they can go out and make sure that they're getting information and people are comfortable working with folks. And so I think that that's going to be key, particularly in the LGBT community, that we are working with our organizations that are already doing great work. And so that is what I look forward to, working with Leader Harris to make sure that we get funding to, again, our community organizations.
Yeah. And I'm going to hop in and just amplify something Lamont just said is, as we roll this out, you know, we have to get people who are doing the contract tracing who are known and respected and trusted within their community. Because, you know, you're going to be going out and asking people very sensitive information about a disease they may have had and who they've been in contact with. So there's got to be language appropriateness. There's got to be cultural appropriateness. There's got to be some trust that, you know, especially I know there's a lot of concern in the Latinx community that will this information be available for some legal proceeding that could jeopardize me and my family. So I will not answer these questions. So you know, there's all these things. So finding groups that are already embedded in communities, whether it's a community organization or, you know, faith-based group or, you know, whoever it is, an FQHC who can go out there and have people's trust. In my area, there are 63 different languages spoken. So just being able to go out and find people who can do the tracing in the appropriate language to get, you know, the right answers, that'll be important.
Let's talk a little bit about LGBTQ, and someone had asked a question about why it's important to collect sexual orientation and gender identity or SOGI data. And LaSaia and Michael, if you could start and talk about what is it that your organizations uniquely add to the universe of response in a crisis like this? You know, a lot of times, a lot of the money goes to massive institutions out there in hospitals. But as Greg said, we need more on the ground organizations. So talk a little bit about kind of how you see your organization fitting in the footprint of this response. And LaSaia, we'll start with you.
I think it's important, just like the census came up, this is the first time in history where they had the same-sex census or same-sex marriages on there as well. But there was not counting the trans people in the population that we have available now. We still have to check female or male in a binary system where most people are not adhering to the binary system, right? And I think it's important that we have, I call it a mirror structure, The reason why I call it a mirror structure is most people would like to come to a space and see themselves. If they don't see themselves, why am I coming to this space? If I don't see myself in leadership, why do I think I should respect this particular space? So it's an important aspect of, oh, okay, I can make it to that point, or oh, okay, I can go to this space and be okay and be able to speak what I need to speak about for my particular narrative because someone is in here that has my narrative. So it's a very important understanding that you have someone in these particular spaces, just like Greg said. You have 63 people that speak in 63 different languages. They need someone that can speak their languages and have them to particularly translate that language. And especially when we talk about the South Side has their own urban language. I don't speak like this all the time too when I speak into my members, right? We have to speak to them where they can actually reach up to us at. So it's important to understand, like, we have to reach our people and actually sometimes have to go down to their level to bring them up to the levels that we need them to bring them up to.
Great.
Yeah, I think absolutely. I think, LaSaia, you're absolutely right in terms of counting is so important. One of the huge issues around serving the trans community related to HIV is no one ever counts the numbers. So all the reports come out and it's like, well, we're targeting the groups most impacted, and yet there are no numbers for trans communities. So I think having communities who can help to identify and count and make sure we're recognizing the need. I think the other issue that's very important, I think your community-based organizations are able to be more flexible. They are able to adapt, they're able to change, they're able to shift to the needs. I think institutions, just because of their very nature, are more rigid and harder to adapt. And I think having that partnership with organizations like Brave Space Alliance and Chicago House, we are able to not only flex ourselves, but together we're able to flex in ways that could meet needs. And I think it's very important that we have that type of flexibility in the system, and we're able to have that impact on a more direct, in a more direct way within communities, I think are essentially important. And I just think something brought, and I think Greg Lamont and people know, bureaucratic systems take time. You don't introduce a change that gets voted on tomorrow and comes down. It takes months of work and processing. And sometimes community organizations have a little bit more flexibility to make things happen quicker. So I think trusting them and bringing them into the work is essentially important.
And adding to that is being able to speak to that particular narrative in them particular spaces.
Yep.
And a lot of the times we're not in those spaces to actually change that, and we're still being counted as men having sex with men. And me being able to run an organization saying this is not privy because trans people have sex with multiple genders and not just one. And that we can change that particular narrative around the paperwork around that, because we're changing the narrative that trans people can run their own organization and do their own particular type of work and actually be in leadership doing that and thriving from that work too.
Yeah, if you look back at the old Chicago Department of Health statistics from the 80s and early 90s, it took a long time for them to start counting transgender people. So the data was distorted, which meant the funding wasn't correct. It wasn't going to prevention in transgender women of color, especially African-American transgender women who were dying that worked at the Baton and other places. People knew they were dying, but nobody was counting them at the level. I know we're going to lose Greg a little bit early, so I want to get to a question from an audience member. And this goes back to the mental health issue. First, the person said they'd like to voice appreciation for the governor stepping in to mandate parity for reimbursement for counseling sessions being held via telehealth. Accessing mental health services via telehealth is vital during this time. Long-term, this is an issue that has to be addressed on both the state and national level for both mental health and primary care providers. What is happening on the state level to address this issue long-term? First Greg and then Lamont. Sound.
There you go. One of the things I think we'll be voting on when we go back next week will be some extensions of the emergency telehealth authorizations that have been in place, so that people can keep accessing services this way, and that insurance companies and Medicaid and the people who pay for healthcare, also have to reimburse providers for services done in telehealth. I know there's going to be discussions about, you talked about mental health in particular, where providers say some insurance companies are now paying for telehealth, but they're paying at a lower rate than they would be for an in-person visit. So we're going to have to go look at those issues as far as payment parity as well as access parity. But it's a whole new world. And also we've got to count into that a huge capital expense for closing the digital divide and broadband expansion, because it's great to have telehealth and have conferences like this, but if you don't have in your neighborhood or your community access to high-speed internet, it's just not a possibility.
Lamont?
Tracy, I'm going to reiterate again the need for our viewers to make sure that you know who your state rep is, you know who your state senator is, and that is very easily found at openstates.com by putting your address in. It's important that, again, and I want to reiterate that we're going to be in for a fight on funding. And so we have to reach out to our elected officials, whether that be calling our offices, emailing us, and letting them know what's important to us moving forward. Because again, everyone is going to be lined up. Other communities are going to be lined up for funding, and we have to make sure that we are letting our folks know how important it is for the issues that are affecting our community, whether that be telehealth, whether that be getting broadband out to minority communities. These are things that are going to be extremely important moving forward. And again, our organizations are going to have to do their part, which I know they're already doing, but it also is going to take each of us to reach out to our elected officials. That is extremely important. That again, we can't wait on the federal government. We have to do our part. And that again is reaching out and letting people know what's important in our community.
Thank you. Greg, a last question for you, and this may be a little bit more personal, but how are you coping with today, but also if there are tips that you have for people from the 1980s. I certainly felt like I was on some kind of robotic automatic pilot in the 80s, trying to document as much of the community as it was being lost as I could. And in many ways, I didn't really deal with it till 20 years later to understand the number of funerals I would go to and of men my age and slightly younger in some cases. I started this work at age 21. What are some of your tips of survival on a mental health and personal level?
Well, you or I may not be the best examples of this because, I did the same thing, back in those days when I'm one of the very few people I know who actually survived the HIV epidemic. Most of the people in my age group who were my friends and peers, all died. And I think at that time when you're in a crisis and there are, bombs and attacks coming from all sides and suffering and death around you, and you have the capacity, personally, because of your strength, your condition, your privilege, or whatever, to go out and help, that's what you do. You go out and help. You suit up, you show up, you go out there every day and fight. And, it sounds like you and I had sort of the same reaction, is at the time you just close out the horror that's around you and the sadness and the unfairness, because there are people who you can help that day get through their lives, and you can help them survive, and you can help protect them. And that's what you do. So, I guess my thing would be, looking back now, I'm being very conscious this time of doing some kinds of self-care things and having some intentionality about taking some time to acknowledge what's going on around me. So now you got me. I was just going to cry about it, so I will stop right there.
I'm tearing up a little bit. We are all human on here, and we're dealing with the crisis of humans. So I appreciate you saying, if you can help. But if you have to help yourself first. Because as the saying goes, if you don't help yourself, you're not going to help others. Now, I do not live by that. My friends and family will tell you I am horrible about self-care. Yeah. But I am a little more conscious about it at age 57 than I was at age 21. And I appreciate all the work that all of you are doing in that sense. Maybe Lamont and
let me just throw one more thing into, just for, at the time, you know, when we were out doing all these little things, those things that we could do as just average citizens and friends, sometimes you go to bed at night wondering, why did I do this? Did this really help? You know, this was hard for me and uncomfortable for me, and maybe I did something, maybe I didn't. You know, I don't think we ever realize the power of one person going out and helping a neighbor and a friend, even if you change one life for the better for an afternoon. And sometimes those things carry on for years. So, you know, go out, don't get discouraged just because the fight is hard and there are a lot of opponents, because it's a fight worth fighting.
Yeah, thousands of people doing an act of kindness adds up, whether that's meal delivery from Open Hand in the 80s when it started to the food delivery that Brave Base does. Lamont, can you talk a little bit, and then Michael and LaSaia, about your own coping medicine, the way that you cope with this now and maybe in the past?
Sure. You know, it is certainly for me, being staying positive, having patience, and then also trying to stay connected to family and friends, whether that be FaceTiming, whether that be phone calls, but then also within my own district, knowing that I have seniors that do not have family, seniors that are in need. And so, you know, Greg mentioned that sometimes you have to get out and help others during this time. And so one of the things that I've done is ask folks in my district, in my newsletter, to volunteer and call seniors within my district, just to make sure that they know that we care about them. Also, finding out what issues and concerns that they have, what their needs are. And so again, you know, first and foremost, it's taking care of ourselves. But then if we have the opportunity to volunteer and take care of others, this is the time to do it. There are a lot of folks that are in need. And that's why it's important that, you know, we support organizations like Brave Space Alliance, that we support organizations like Chicago House, you know, volunteering. If you do have extra resources to give to both of those organizations, that's extremely important. And I just want to if I can veer off for one moment, Tracy, is to let our community know that we are very, very fortunate to not only have you, Tracy, but also to have Greg that has the history, and Michael as well. You talked about the history of the 80s. I'm not going to put my dear friend, Ms. Wade, with me from an age group standpoint, but really when I think about Leader Harris, knowing the background that he has, and also he takes that lens, that knowledge, that fight, and that history to the General Assembly. And he's been doing it for years. And so we really need to give Greg kudos for the work that he's been doing for years for our community. And so I just wanted to put that side note out there, if I may.
Absolutely. Many historic firsts that Greg has been part of. He followed in the footsteps of Larry McKeon, the first openly gay HIV positive state legislator. He took over for Larry's seat, and now he's made history in his leadership roles in the state. And Lamont, you're certainly also in the history-making book. So both of you have really done great on the policy side. Michael and then LaSaia, talk about kind of your coping mechanisms as well as what you might recommend for others.
I think, you know, like you, Tracy, I think all of us have a little tendency to workaholic. We tend to get into the work mode. I think during this time, one of my care things has been making sure the organization can still function. We are, you know, 85, 90 strong out in the community. And so my goal has been doing everything I can to make sure that our team is able to do their work, that they're able to be creative around prevention, continuing to use social media and all kinds of mediums to do prevention work, to continue to encourage testing, to work on developing home testing programs, making sure our linkage to care is still happening. We need to make sure the clients that we work with are taking care of their HIV, are continuing to go to the doctor even though they're told never leave the house. How do we make sure that linkage to care continues to happen? All of those kind of services, I think, are extremely important. I think the other thing is I look at the work we do Even though we bring the years of being in the battle for HIV, I think there are also a lot of tremendous new ideas out there. I think LaSaia and many other grassroots organizations are budding up, and we have to find ways to support their growth and their continued success. So I think it's very important within my own team, partnering with other organizations on the grassroots level. I think it's very important that that continue. That's the only way we're going to be able to thrive and really combat the virus, HIV, COVID as well. I think there's a lot that can be done. I think there's a lot of creativity and initiative that's available to our communities if we can continue to work with it.
You diverted off the personal very well there, Michael. I'm not going to call you out on it. You're welcome to divert as well, because it is a personal question.
I'm not going to divert because I think
you're going to be a mom soon.
Yeah, I'm going to be a mom very soon, in a matter of 2.5 months, right? I think my narrative includes all of it, right? So I was not alive during a epidemic, right? But also I've been alive during the crisis that trans people have been dealing with since the beginning, being murdered left and right, being able to have to continue to fundraise for trans women and trans men to be buried, or even fight for them to be buried with their names that they fought so hard to be living in, right? So it's a continuous understanding. Like before this pandemic happened, we was already in a crisis. Before this pandemic happened, we was already losing our numbers, be it murders, be it HIV, be it anything that society deemed as not norm for trans people to be a part of. I think for me, I have to appreciate my partner, which is eating a good old sandwich in front of me.
Mine's doing laundry.
Which is, without him, I don't think I would have been able to make it during this pandemic. I would have been on the ground. I probably would have been one of the people that probably caught COVID right now, right? Trying to support the people that's on the ground. I'm trying not to tear up because he's the one that's been keeping me in the house to understand that we have a little one on the way. We have a family and legacy that we're building on our own, and we have to be able to not only take care of ourselves. If we don't take care of ourselves, who can we help? How can I help people? And how can I get this particular conversation out there? I'm one of the very few trans women that has this particular type of language or education and knowledge that I do have, and also able to use my power in particular ways to be able to change particular narratives with the city and the state around transness, right? So it's the understanding, like the continuous to take care of myself, to be able to take care of a community that I have to continue to uplift in these spaces. But he and our little one is what's allowing me to push through and to see their face and being healthy while seeing their face is the main thing that I am looking forward to be able to see that. But my self-care is anime and watching movies. Medea has been doing me wonders these days.
Oh, Tyler. So final question for each of you, and we'll start with Lamont, because your intergenerational poverty bill, which is so much along the lines of reparations discussions that are necessary for our society to have. The disparity between races in this country is just phenomenally massive. And that intergenerational poverty gets exploited and gets worse during times of crisis like this, when homes need to be remortgaged and the assets they might have developed in this generation start to be spread out among many people who need help. So talk about what that bill might look like, and then LaSaia and Michael, for your final comments, maybe an aspirational policy that you would like to see changed at the state level. So Lamont.
Thank you, Tracy, for letting me have the opportunity to talk about this important bill. Again, we're not surprised by the high COVID numbers in the African American Latino community. Again, it really comes down to poverty, lack of quality healthcare, lack of quality education, lack of quality housing. These are things that we've been dealing with in our community for years. And so this bill is not only to study that, but put processes in place for us to be able to end poverty moving forward. And so, you know, I'm excited that I'm getting some support on this bill. I will ask, again, the organizations, the viewers that have tuned in to support this bill, reach out to your legislators to also support the bill. It's extremely important that during this time, the veil, the sheet has been pulled back on the systemic poverty that we're seeing around COVID. And this bill, I believe, will do what is needed to do to fight this poverty. So we won't have this pandemic again. And if it does come back, we will have things in place to be able to combat this. And right now, we don't. Right now, we're not prepared because, again, there are things that are in place for years that have put the African-American and Latinx community, Latinx community in places where when pandemics happen, we are the hardest hit. And so again, this bill not only studies it, but it puts things in place that we can end poverty moving forward. And so Tracy, again, thank you for allowing me the opportunity to discuss this bill.
Great. So about a minute each for LaSaia and Michael to maybe talk aspirational on a policy level.
I'll just quickly, I think Chicago House it's housing. We've said for years, housing is healthcare. I just think in order for us to help bring about the end of the epidemic of HIV in Illinois, in Chicago, we have to have more focus on housing, and we have to have more housing available to people who are vulnerable.
Thanks. LaSaia?
I want allocated funds allocated to trans individuals in the state of Illinois. It's very much so that we continue to fight to have just 2% of the 100% that everyone else gets. I want at least 20 million dedicated for trans individuals to run their own programs and organizations throughout the state.
Yeah, and I think that's really key, is to have organizations run by us, for us. We have a lot of LGBTQ organizations that are run by LGBTQ people, but the vast majority of those are white identified and cis and male identified. So to make sure that we have creative ways that we fund organizations so that if they don't meet all the 501c3 requirements, that we don't make them go through extra hoops or give them less. A study came out this week that showed that organizations led by African Americans overall get less funding than organizations led by white people. So we need to get rid of cultural and other forms of racism in funding. I want to thank you all for being here. Thank you to our ASL interpreter, Ronda Estell. It's been a pleasure, as always, to get to know you all each a little better. Support Brave Space Alliance, support Chicago House, and support LGBTQ organizations. Thanks again for joining us.
Thanks,
Tracy. Everyone have a good week.